I'm so glad. Am I the first person today talking? Yes. Ah, yay. So today is not just talking about cancer. We are going to be talking today about confidence, confidence in your body, confidence in your healing, confidence in your choices. This is what this retreat is about. And whether you are in treatment or recovering from treatment or know somebody that's in treatment that you love, this retreat is to bring you knowledge, to empower you back to what was taken away from you. Because I think we focus on medicine so much when you cancer. Well, I've got to do it because I don't want to die. But no one focuses on the importance of your choices were taken away from you. When you're a cancer survivor or you have cancer, you have no choice. You have something that's invaded your body, and you weren't given a choice. Maybe we made choices a long time ago, diet, and that kind of thing, but you haven't been given a choice, so we don't talk about that, and that's what this retreat is about. It's confidence in your health, because even though you weren't given a choice many years ago or recently, you get given a choice today. How we cope with it, what we eat, what we do from this day forward. Okay. At the Mission Clinic, as a functional medicine doctor, my focus was to bring all the treatments to one place, to offer as much as possible. So one of my biggest focuses that I did, and when I worked with the cancer hospitals in the UK, is acupuncture. So I do a lot of acupuncture. So acupuncture on the Chinese medicine side, as well as the musculoskeletal, where we work on the actual body. And what acupuncture is acupuncture is putting fine, small little needles. We all have a central nervous system. Of that central nervous system, we have a peripheral nervous system that moves out and an anatomical nervous system. That's what we've got. What we do with the needles is we go into the meridians. Meridians are part of the nervous system, and we rebalance the body. And that is what acupuncture does. For every organ in the body, we rebalance it. If our kidneys don't work, then another part of the body won't work. When we have toxins in the body, chemotherapy, any kind of medicines, our bodies can't function in the places where they should have functioned. So that is what acupuncture is there for. The acupuncture we also use is AcuDetox, is auricular acupuncture that we use in the ears. This is very, very good for during chemotherapy or sickness. It helps with the nausea, the vomiting. And so we use it when patients come out of a session, and we would put it in to stop with their vomiting, without their nausea, with the actual side effects of the pain that the medicine's given us. We also use it to then, after you've had all your sessions, you come in and we start detoxing your body, your liver, your kidneys, your whole system. So we get rid of what's been left in your body that shouldn't be there, so that you can get a natural mitochondria. You can heal naturally by yourself. So that is what acupuncture is. MSK, or medical acupuncture, is for that sore back, those knees, the hips. Everybody here looks like we should be perimenopause, menopausal, post-menopause. So we all know when we get out of bed, whoa, oh, and you think, and a doctor will take x-rays and they go, nothing's wrong with you. Listen, our hormones do that to us, okay? If you've had breast cancer, you've probably been put on estrogen to stop your estrogen for years, or you've been given a hormone that stops some of your hormones. Those are important hormones, because without them, we do feel body pain. We do feel aches and pains. So the acupuncture and bodywork therapies that I do and that I offer at the clinic are for that, where I can go into the actual structures and we can relieve the pain without using something that's harsh on our systems. Auricular acupuncture is in the ear, it's our ear, and the bodywork acupuncture is what we do, fine points in our body. And the needles are small. If you take two little hairs and you put them together, that's how small the hairs is. It's like a little, so they're not painful. It's not painful to go in. You don't feel them. In the ear you might, because we've got a little bit of cartilage, but it's not a painful. But what you do experience is relaxation, because I go into the sympathetic nervous system. go into the mind where you've got anxiety. It's a really good thing for anxiety. The reason that it is so successful and does so well for women that are ill or are going through cancer is cancer is grown through stress. The more stress and the more stress you have, the worse your condition gets. So we want to bring that down. So we want to do something natural. So with acupuncture, what we do is that I do a full examination when you come in, and that's the correct way of doing it. And we look at, instead of me looking at, because I know that a lot of, you come back with, a lot of people ask me that, you come back with the yin and the yang and the difference and the this, and that's Chinese. But you can look at the positive and negative energies in your body. Because that is exactly what acupuncture is. It's not about changing you in a spiritual world. What it is about is it's about the positive and negative energy that you have within your body. And that is, if I had to take a tester that they use it for electricians and I had to put it on you, it would show electrical energy in your body, because your body has to work on an electrical field. And that is why when we have something wrong with our bodies or our minds or something happens, that electrical field that goes through is shorting out. It's like taking a nail or a screwdriver and putting it into a socket at the house, and it shorts and the earth leakage drops in your house. So that is what happens when you've got something wrong going in your body. And so when the needles are placed, they are sterile stainless steel needles, and we put them into the point, and it's like putting something in and it earths your body. So it gives you that effect immediately. And it's just to do something that changes. These are just different kind of therapies that you can look at. As a functional medicine doctor, I look at optimal health. So optimal health means looking at your blood work. I know when you bring your blood work to me in the beginning and you've been sick or you've been going through stuff, it looks haywire, which is fine, but it's not about normal readings. It's about optimal readings. It's about getting you into a place where you are optimized. And what I see myself as my role as a doctor and as a person on the island that works with my patients, I am a coach. I'm here to coach you how to control and take charge of your own health. If you get to a doctor and a doctor says you've got to start this medicine, and you say why, and they're like, well, you have to start it, find another doctor. You should be asking, okay, what are the side effects of the medicine? What are the alternatives? If you cannot get that answer from your doctor, find another doctor. It's not being rude, but you should be able to make that. That is taking back the control that was taken away from you. The other part of the clinic, besides the medicine part, is we offer different kinds. So I have different kinds of treatments that we work with. So one of them is Rife therapy. Rife therapy is electromagnetic therapy that goes through that we work through your body. So Rife therapy was introduced many years ago, many years ago for cancer treatment. It was taken and they used this electrostimulation energy in the US. A doctor found it and he was interested in placing it into cancer cells. They used cancer cells and it destroyed the cancer cells. Unfortunately, he was arrested and the FDA put a stop to it immediately. Okay, so that was one. So we also do Rife therapy in the clinic. The Rife therapy is not a standalone treatment, but it's an add-on treatment because when you go in it, we're sending electromagnetic stimulation through your body. It's like sound waves, and all our bodies work on sound waves, but there are certain waves in our bodies that are incorrect. And so what happens is this kind of energy goes and sits around that, and it starts helping with the destroying of what's going in your body. So Rife therapy is also one of the therapies that we offer. You don't come in for Rife therapy, you come in for 45 minutes to an hour where I will give you whatever you need. The other thing that I'm excited about in the clinic is ozone therapy. So we have auricular ozone where we put it onto your ears. We have ozonated glycerin. Ozone is a supercharged oxygen for your body. Ozone is used, ozone therapy, Rife therapy, but specifically ozone therapy, and with some of the other therapies are used in Europe at the moment. If patients have got cancer and they come in and they're going to do chemotherapy, they put them on this immediately. Some patients don't do chemotherapy and they only do this therapy before they start. So ozone is a supercharged energy. What it does is it kills any virus, bacteria. Cancer is a virus. It kills it. So as soon as it comes in contact with it, that cell dies. Ozonated glycerin, or glycerine, is really great because it is a very high amount of ozone. Glycerine, vegetable glycerine, is sweet. Cancer is attracted to sugar. So what happens is when you start, we ingest it, when you start ingesting ozonated glycerine, those cells are attracted to the sugar. As soon as they get to that, the ozone molecule explodes and it kills the cancer cell. These are things that are extra. We have patients in Nassau that have breast cancer that can't get anything more, where we've used it just to start getting the tumors out of them. But this is something that's also available now. The ozone, that's an alternative. It's not a standalone. It is that instead of having one treatment, you look at all the different options. If you have had cancer, then preventative care is important. Preventative care is, what do you do now? Getting onto your treatments that you're going to take now to prevent it from happening again, to prevent any of the health that has happened to your body to get better. And so I also bring in body work. I believe that everybody needs to be touched. My patients need to be touched. So that means if it's working your body with a lymphatic drainage or a massage, it's more medical, or your feet, reflexology, a bit of the aromatherapy. I don't use all the different kind of oils because anything you put on your skin, it takes 20 seconds to absorb anything. Did you know that women in one day come in contact with nearly 180 different chemicals that are absorbed in your skin? Men are a little bit lower, but women are higher. Hair, soap, washing, creams in our body, what we bath with, our toothpaste, anything that comes in contact with your body takes 20 seconds to absorb. So we've got to be very mindful. You can't stop touching anything. You can't stop using things on your skin, but you've got to be very mindful of what you use. We have I wish Dr. De Silva was with you this week. He's been traveling crazy, but we have a skincare range that he works with House of Health that he developed, which is non-toxin, no fillers, with nothing, and it was just a plant-based. And we use that. I mean, that's my go-to for everything, because I know if I put it on my skin, I'm not absorbing anything that's bad. I'm absorbing greatness because it's all plants. That's great. If they're using the cream that you're using, you want to look at, I think some of the worst products that we buy are like organic. They're like, this is organic, and then you go read at the back and you're like, oh, that's got these things added into it. So it's not that you can't use them. You just got to start being mindful of what you're using. Ladies that have come from an experience that was not good, you don't want that. You have an immune system that's down. It's not something that you just leave and that it's gone. But there's a great healing in understanding what your body can tolerate and what your body can't tolerate. It's very important. And then what we supplement with. So 20, 30 years ago, the vegetables and the fruit and the things that we were eating are no longer the same. What you get out of a tomato today and what you get out of a tomato 20 years ago, it's not the same kind of vitamin C. So supplementation is very important. So that also forms part of functional medicine. Functional medicine is looking at, my focus is to look at, the first thing I look at is what you fuel your body with. Fueling your body is, I don't like the word diet. Diet, because then everybody picks up weight. Because you're like, oh, I can't. Fueling your body is what you put into your body and how it makes you feel. Dr. De Silva has a great way of explaining it. If you go and buy yourself a nice sports car, get a nice little red Ferrari, and you put gas in it, but you put a real cheap gas in it, it's not going to perform as using an octane that's really high. So that's the same as our bodies. Is what we put into our bodies is how we fuel our body for energy. And if we put the incorrect thing into our body, we're not going to fuel it correctly. There's the times that you have this incredible cake, or you eat something that looks so good and afterwards you feel so bloated. That's a sign that you fueled it with the wrong thing. You don't have to go and have all these tests done. It's like, did it work for you? No. Okay, then change your diet. The easiest. The second one that I look at in functional medicine is hormones. Hormones are very, very important. We think that hormones are teenagers, and we think ladies that are coming into their cycle and having babies, and then when we get older, we're like, what do we need hormones for? We do. Even though we are in menopause or in perimenopause, we need correct hormones. The thing is, when they look at, unfortunately, the Bahamas, they don't look at hormones like that. But if they do, they want to give you a hormone replacement therapy. That's a no-no. That's ready to give the next part of your body cancer. But you do get bioidentical hormones, which is a plant-based hormone, which is biologically identical to the hormones in our body. So in that kind of field, we want to look at when you're coming in, I want to test your hormones, I want to see where you are. Or do we need to change something in our diet to bring up our testosterone? Or to bring progesterone that drops now. Estrogen, some of us are on estrogen stoppers, medicine that stops you from having estrogen because you might have had breast cancer and you've had one removed, but you haven't had, then they want to stop that. But we've got to look at what you're on. I had a patient 2 weeks ago that came to me. She had breast cancer 23 years ago. She still has a port in. I said, why? She goes, oh no, they just said just in case. And she's still taking estrogen, the one to stop the estrogen in her body. Oh, just in case. I said, but your levels are normal. She goes, oh, they just said just in case the other breast. 23 years. But that's where you advocate your health. You know, if you don't have the means and stuff like that, find out. Ask somebody. She's unfortunately goes for her tests at Princess Margaret, and this is what they do, and the doctor just says so. It's just in case it happens. No, man, take that out. Make sure that your hormones are correct, because if your hormones are correct, you're going to be cranky. You're going to have incredibly painful legs and sore bones. Your system, your thyroid might not work. Your sex life will be none. It's true. How many are married or in there? Okay. When you have gone through menopause, when you've gone through menopause, there's nothing worse than sex or intimacy. It's painful. It's so painful. It's so uncomfortable. That's not because there's something wrong with you. It's literally your hormones. And they can be looked at. And bioidentical hormones is like anybody would compound a script. You would look at your hormones, you would see what percentage you need to change, and you would go on to a bioidentical hormones. Dr. Derek De Silva, that joins us on and does all our supplements, he's one of the top hormone specialists in the States. He does so much, and what he does is used to get pellets that you put under your skin and creams. He does a sublingual, so that if it's too much, you can drop it. There are such incredible studies at the moment where the doctors abroad are using ladies that are in breast cancer or can't take estrogen, where they give you testosterone, because we have to have testosterone. Estrogen does not cause cancer. That's a myth. Bad estrogen does. Testosterone does not cause prostate cancer, because then every 18-year-old boy would have prostate cancer. Our testosterone levels in young men are at their highest between the ages of 18 and in their early 20s. The highest. That's normal. So if testosterone caused cancer, wouldn't all these young men have prostate cancer? It's the wrong form that can create that. So it's not true that estrogen gives us cancer. The wrong form of estrogen does. Okay. The third one that I look at in functional medicine is supplements. What supplements are you taking? Okay. Everybody in this room should be on a vitamin D3. Should. If you're not, you should. The reason for that is D3, we always think it's a sunshine vitamin. So it's a vitamin we take in the morning because the sun comes out, it's a D3. The thing is, it is one of the best cancer killers that you get. They do not tell you that. It's not only immunity, it works our hormones. It has our natural estrogens correct. The one thing you have to look at is D3 cannot absorb in the body without a K2 vitamin. So if you're ever on a D3, you have to make sure that your vitamin D3 has a K2 in it. Otherwise, it doesn't have place to absorb. Now, there are 5 vitamins that work together, where all our vitamins in different things work together, but 5 that work together. You need D3 to make sure the calcium moves correctly. So how many of you had scans and you had little calcium pockets in your breasts? Or you see kidney stones, or you see those little white calcium. As we get older, people get those calcium little, we call them little cholesterol rocks. In order for D3 to be, in order for D3 to be moved in your body, our natural D3, so even standing in the sun gives you D3. You've got D3, but standing in the sun, it won't move unless you've got K2. D3 moves calcium. Calcium moves magnesium. You see how supplements work together? Yeah, so D3, you should all be on D3. And recommended, you should all be on a probiotic.
What's that?
A probiotic to get your gut health. Without a good gut health, nothing can absorb. All disease starts in the gut. Our second brain is our dementia, Alzheimer's, memory loss. It's in our gut. Those are really important supplements to be taken. Women, we should be on omega-3. I don't do omega-6 because it has the additives in it, omega-3s. As we get over our 40, 45, we should all be on an omega-3. Because omega-3s are so important for brain and our health. If you are have a blood pressure problem, magnesium and coenzyme 10. CoQ10 should be, the coenzyme 10, CoQ10, should be something that everybody takes from the age of 45. Reason is, our natural CoQ10 in our body declines every year. There are 4 things that remove CoQ10 totally from your body. Diabetes medicine, tablets, blood pressure medicine, age, and statins. If you've ever been on that, you have no CoQ10. CoQ10 is cellular energy. It means that you need energy in your cells to get healthy. If a cell, we've all learned in biology, a cell duplicates, goes more. If that cell is unhealthy, what do you think it's duplicating? An unhealthy cell. So those are important things to be on. Statins for cholesterol. If you're on a statin, please take my number and I'll give you an alternative. Okay, statins is a no-no. It's every doctor will say their thing. I will give you the facts. Statins are 1% of the population benefit from it. The FDA and all research shows that there is an 8 to 11% chance that a statin will work. There's a 67 to 88% chance you will get type 2 diabetes. You will get dementia and Alzheimer's. It does cause pain in your body. Cholesterol is needed for eyes. Cholesterol is needed for every organ. Cholesterol is needed for your brain. We need cholesterol. When you go onto a statin and you take that cholesterol away, you have eyesight problems. We have onset dementia. We see a lot of it on this island. We have pain. We have a lot of problems that come with it. There are alternatives to it. And that would be a whole thing of like, okay, what's your weight? What are we eating? Okay, why is it looking like that? Usually your cholesterol will be high if your sugar's high. How are we going to bring that back down naturally. What are we going to do for weight loss? Do something natural for weight loss. But cholesterol medicine is something that you really need to research, and you really need to look at the benefits or ask your doctor, what are the side effects? No, it'll keep you alive. With what benefit? The medicines that we take. What else is very good? Cancer, vitamin C. So if you're iron, if you've got an iron or an anemia, your iron is low. Iron cannot be absorbed without vitamin C. Vitamin C is the carrier of iron in our body. How many ladies have been on iron tablets because they needed to be on it? Ever have side effects like nausea, constipation? Okay. So what I always suggest to my patients is taking iron. Iron stores for 24 hours and it moves. 24 hours and it moves. So often I always say, take it every second day. One day on, one day off, one day on, one day off. And in between is your vitamin C, double up vitamin C, and it starts moving through. It just helps you with your blood, bringing your blood back. It's very important. The other thing we do, or I do at the clinic, is I offer IV therapy. IV therapy is giving you a multivitamin boost, increased amount of vitamin C, depending on what you're coming in for. Methylene blue. Who's heard about methylene blue? Have you ever heard of it? Okay, so have you seen all these things they speak about on TikTok and all over? They talk about methylene blue, they talk about fenbendazole, ivermectin for cancer. I do that. That's my protocol, okay? We also, Dr. Sai will go through everything with you. We also do salicinium. Salicinium would be IV salicinium, where we'll probably put a PICC line or something in for you if you're going through cancer. And then we use mistletoe. Mistletoe like you see in the trees mistletoe, but it's a specific kind of mistletoe that gets injected, because mistletoe is like a parasitic plant. So when it finds that cancer, that's what it does. You know, so, but the fenbendazole, the ivermectin, that whole treatment that we go through is something that we do in IV therapy at the clinic that we look at. Even where you are now and you're in a healthy state is coming in and having a good parasitic clean. Get a good fungal clean, because there's a lot of talk about where does bacteria or where do these things come from? Are they coming from bacteria, or do we have something parasitic in our systems? And so we clean it out. I'm an ivermectin girl in using it every week. I do an IV, or I would just put some on my skin. I use it for whenever I see a whole lot of patients coming in and they're sick, coughing and all that. Then I use it because it stops me from getting sick. I used it through COVID. So it was something that, it's different, fenbendazole, but you see that is a treatment that we use. So IV therapy is there. So methylene blue is, it's the thing when you go to the toilet, your urine will be blue or green. Methylene blue is a supercharge of the mitochondria. The mitochondria is your cells, and what it does is it's a big boost of energy, a big boost of oxygen into your body. It crosses the brain barrier of the brain, so that it helps with stopping in dementia or brain fog. We go into the brain fogs. It helps with sleep because it oxygenates our body so well. It helps with depression and anxiety. It helps with cancer. It's something we would put in. Someone with cancer would be going on methylene blue, either taking methylene blue, or we do a methylene blue IV, and you would have red light therapy at the same time to activate it. Or I would take methylene blue, like I took it this morning, and I'd leave my car open and I'd let the sun hit me. But there's been great ways of many women that have beat their cancer using methylene blue and that protocol and getting into the sun at that time because of what it does and changes in your body. But it's a nice boost of energy for your body. So those are like natural things. We use DMSO. DMSO is made from tree bark and sap. That was something that they'll put organs on hold when they're going to do an organ transplant. They will use it for a big bladder problem, but then they'll stop it. The FDA will stop it in certain places when it started getting good. But it's something we use. We use it for body pain. If you have an ache in your body, we spray method. We spray DMSO. You might smell a little bit garlicky because it smells garlicky and onion, but it's one of our incredible treatments. I have rheumatoid arthritis. We have people with pain disorders, or people that the osteoarthritis where we don't do anything. You come in and do DMSO IV to help, and it just drops all that inflammation. The thing with that is that if you're married, you have to just maybe stay out of the house for 2 days because you will smell like, or you got people living with you, you will smell like garlic. It's got like a garlic onion smell, but that's not the bad. And then the other thing is, who's heard of colloidal silver? Colloidal silver kills bacteria, funguses, everything. If you are interested in, especially with who you are and what you're doing and something healthy, I make colloidal silver. I also do make our own ozonated glycerine. I make colloidal silver. We use it in IVs. I give patients a direct IV. A lot of my patients drink it on protocol every single day. But it's so worth buying the machine. It's not that expensive. You just find out, I just send you which one we've got, and you can make your own ionic or colloidal silver. And you drink it. So it's supercharged water. Well, it's not, it's sterile water that has a silver, or it's got a certain energy in it so that you drink. And it's very healthy for your body. You use it for nose sprays. So I make nose sprays, just colloidal silver. You've got sinuses, spray it in your nose. You're not using anything.
What do you make it from?
From sterile water. So the water we have on Eleuthera, you know those big buckets, these Southern Water or Lutra-Pure or whatever you've got, the bottled water. I've tested that. We put that through the tester and they are 100% okay to use. You just use it with water and it spins and you get a light and you can actually see the silver in the water. We use it for eardrops, eye drops. Anybody that's got injuries, pain, sores, open sores, infection, you put it on that. The colloidal silver kills bacteria and viruses and pathogens immediately. And it's the cheapest, easiest way. Those are natural things to use. You do get, it's not colloidal silver. There is a silver that people take and you'll see people turn blue. We don't take that. That's too much of something that's not correct. The other thing is that when it comes to supplements and looking at your health is a methyl form of vitamins, especially your B vitamins. Okay, you've seen a lot going on at the moment where they've spoken about autism and the mirth gene and all that kind of thing. Okay, that is, patients will ask me, we can do blood tests to see if you've got a resistance to it or not. But I mean, that costs so much money. Why? Rather take your vitamins in a methylated form. Methylated form means the natural form, and that's for all your B vitamins, B12, and then your B complexes. The synthetic form of vitamins can make you feel sick. Some people disagree. Some people are allergic to it. You'll have your B12 where someone will take it and they'll have an allergic reaction. Then it's not methylated form. So in order for you to properly absorb a B vitamin, I do suggest that you look at your methylated forms of B vitamins and B12s. I have a B12 folate sublingual that you put in, and it's a nano, it absorbs immediately. That's methylated. And we've just pulled our B complex off our line of supplements. So our supplements are called common sense supplements. That's Dr. Derek De Silva supplements. I bring it in from the States. You can't buy it online unless I give you a code, and we bring it in and I keep it at the clinic. If you're in one of the other islands, we can do something like that. You can order it and you can get proper supplements, meaning that there are no fillers in them. They are made at our laboratory in New York, and all the products are sourced within America. We don't bring in anything like that. And the scientist and doctor behind each and every one of them is Dr. Derek De Silva. So we know that it's not what you take, it's about what absorbs in your body. Okay, so we've just pulled our line of B complex because we had some of them that weren't synthetic, and we've now got a methylated B complex. And then your blood work, ladies. So we've spoken about supplements. The next part of it is, part of the supplements is also doing your blood work. Blood work is not just doing your normal blood work. Do your vitamin panels. It tells you how much D3 you've got in you, and it tells me you'll be 12. D3, the normal range, they say is 20 to 100. Scientifically, you are D3 deficient if you are under 50. I have never met anybody that's come to me with their D3 that's above. So 50 is baseline. Optimal is 77 to 85. That's optimal. I keep my D3 at 70, between 77 and 82. I keep it there. So an optimal, you want to be optimal. You've got to be optimal, because from where you're coming from and what you've experienced, this is really important. So your vitamin panels are important for me. Who's all from Eleuthera? Oh, you're all from Nassau. Okay. Eleuthera. So if you're doing vitamin panels in Eleuthera, your cheapest place to go would be Rock Sound Family Medicine. They always have it. We also do blood work. I do blood work and then send it to Nassau. In Nassau, you can get it from any of your, if your doctor's going to do it, just ask for your vitamin panel, because those are important. And there's not many optimizing doctors, physicians that look at all those little things, but that's why we've got numbers here. You let me know. You say, hey, this is my bloods. Is this correct or not? You know, what can we do? Because it's all about you. It's about feeling better, not being so tired halfway through the day. If you're exhausted by the time the afternoon comes and you just can't get up, it's most likely your B12 and your D3.
So, Doc, how do you know what to take if you take a multivitamin and then the turmeric, the calcium, the D, the C? I mean, do you need the multivitamin, or do you take all of those?
So you can stick to one good multivitamin, but it just depends what that multivitamin and what they're adding to it. So a multivitamin would be just everything put together, put in there, and it's not going to be methylated. It's just going to be something that's going to give it to you. Unfortunately, we're only going to absorb about 10% of what you're taking if it's not in the correct form, if you're not healthy. Alternatively, you can go on to targeted supplements, meaning we go on to a probiotic, a vitamin D, your omega-3, and that just is, hey, can I see your bloods? Let's look at what you need. What are you feeling? How tired are you? Where are we going? Multivitamins are great, but if they're not in the correct form, you can take as much as you want and your body won't absorb it. We do have a multivitamin at Common Sense. We do have a multivitamin, which is methylated, which he makes, if you don't want to take anything. But I don't think the D in there is enough. As a cancer survivor, you should be taking more, and you should be taking a probiotic. If your stomach is not well, doesn't matter what you take, it's not going to absorb. Your gut health is very important.
Right. Do you get sufficient probiotic from yogurt?
No, not with what they supply here. Because there are bacterial things into your yogurt, so great, it's for the gut health. But as soon as a good gut bacteria gets into your stomach acids, it dies. It doesn't all get absorbed. So you want to make sure that you're getting it through the stomach into the colon, because you want the gut healthy like that. So yogurt is not enough. It's not enough. And also is every single yogurt has probiotic on it. How? And it's gone through a heating process to make it, and it's gone and sat, and then it's gone through the machines, and it's closed with tinfoil in plastic. Could that be healthy? No. We don't have those options yet. Yeah, go to Europe and you'll get pure yogurt in a glass that's been made, and it's got, then you can read the little strains and stuff like that. That's great. Yogurt is great. It's not bad. It's going to help you, but you're not going to get everything in. Researchers look at maybe 30 or 40 years ago, the kind of bacteria we used to have in the gut as born, and that's what we always had, have been destroyed. Some of them aren't there anymore. And that is because antibiotics, every time you're on antibiotics, every time you're on a medicine, it makes that part of your body not correct.
Doc, say, how about Centrum Silver for women over 50? How about that vitamin? Is that a good vitamin for a cancer patient?
Well, for any patient, it's a vitamin. Okay, so when I can't say Centrum, if that's what you're using, that's great. I can't say that it's bad. But as soon as you put a vitamin in a tablet form, it's had to go through a process to be done, and it's got binding agents in. And they're just putting in a little bit of everything. So yes, you're going to get some of it, but you're not going to optimize it. That's the difference. You can do, you'll get my number over here. You'll get my number and stuff like that. What I can do is I can always send you the link, NASA, the link to the Common Sense, and just give you a little code for the cancer patients. You just go in and you can order. Or you can find out if we've got it here and we have to send it to you in NASA. We also have a multivitamin. If you're on a multivitamin, great, then that's what you're on. Then you don't need to add all the other things, but you still have to look at a probiotic, you still have to do a vitamin D, and I would still suggest an omega-3. All those other minerals are in there. Don't do omega-6. Omega-6 has got some of the other omega-6 has got some seed oils in. Omega-3 is a bit different.
I know I do my vitamin D. They don't have it as a part of my CDC, but I do it separately because I know the last time I did it was like 21.
Yeah.
And so they put me on a high potency D3.
Yeah. So test it again and look. You'll see these darker marks that you've got on your skin like that. It's immediately telling me your D3 is low.
You see that?
Yeah, and zinc. Yeah.
Dr. Kim, question. I know you mentioned the port being in for excessive period of time. What is the length of time should it stay in once you have completed your treatments?
So your doctor has to decide on that. Okay. They say 5 years.
Mm-hmm.
I've had one removed after 3 because we healed. 3. If you've had it, if it's staying there because just in case, then it shouldn't be there because then it means you're waiting for cancer again. Come on. We can put another one in. But it's that flushing of it and cleaning of it all the time and everything like that. Never knowing when you're going to access, but I would say up to 3 years. But your doctors are going to be different, but you can request that. We just believe if after 3 years you've come clean and clean and clean, I think that's a good time.
So we could talk about reading labels.
Sorry, I'm just looking. Reason I'm looking at my watch, I'm flying to South Africa this evening. I have 17 hours flight coming on, so I have to make sure that I get there.
Yes, good question. In
Yeah.
regards to reading labels and purchasing of the vitamins and stuff, what are the names that you should look out for that if it's shown on the back of the vitamin that you know it's not?
Okay, so let me just put it straight. Now, Nature's Bounty, Nature's First, no. Who owns them? Pfizer. They are owned by the pharmaceutical companies, meaning that a pharmaceutical company cannot get an FDA approval if it has a supplement in it. But what they can do is you can get these sleeping things that says melatonin, FDA approved. It doesn't have melatonin in it. It has one of the molecules so that they can put it on the label. But they can't say melatonin because then it's not FDA approved. Go to an organic health store. Get your tablets in powder form or capsule or gel. Don't take tablets because then it's gone through a machine. You have hundreds of places that are selling magnesium. We go to China, we order 300 tons of magnesium. It comes to the factory and they fill your stuff up. And then that company orders the same from that China company. So what's the difference? You've got to know where it's coming from. I can give you because I know and trust one that I would use, and then if there's a health store that's got really good a health store would have something that's not a big brand. And that's what you want to take in. What you want to look at is fillers. What is it filled with?
Well, how
You
do
know.
you know
Just what kind, I'm now on this vitamin.
What's that?
how do you know where to begin, Dr. Kim? Like, do I need to go to my doctor and let him do a blood test?
When last was your physical done?
Sorry?
When last did you have a physical?
January.
So within 6 months of a physical, we just look at your bloods, and then we just look at what's all the counts, what's your CBC, oh, that looks good, get a vitamin D. You have to ask for a vitamin panel.
Yeah.
Actual vitamin panel.
A vitamin panel, where they test your D3 and they test your B12. You can test magnesium, that you can test vitamins, that's a different part of it. Nature-wise, I don't know nature-wise is not bad. I can't, nature-wise doesn't, they use, this one's fine. It's not about that, it's what, okay, so that's what they've done. They've done it in a soft gel and they're using coconut oil as a carrier. That's great. That's what it is. It's an oil in the soft gel, that's what your carrier is.
One of the places, Life Extension.
That's in Nassau.
No,
US.
Florida.
Oh, US.
Yeah.
What about vitamin B17?
No.
17, like, yeah.
I don't know them. I'll have to look. But I've heard of Life Force.
It's
Life
like
extension.
Life extension.
It's like a nut.
Apricot seed.
Apricot
Seed
seed.
is vitamin B17.
B17.
Oh.
Latrate, what's the scientific
It's
name?
very
for it?
bitter.
Latrate? Apricot seed. What's the name?
Yeah. But a good B complex has all of that in that. So you'll have a look at that. Good B complex is in it. But then also you want to look at B1 to B12 have all neurological nerve. B1 is very important because it changes food into energy, all that kind of thing. But all those other Bs in that you've got, you must look at in a sense of targeted. For what reason are you taking it? If there's no reason of a short, don't keep adding. A lot of vitamins, even the good vitamins, taking a whole lot of vitamins because you want to be healthy, and even if they're the best in the world, too many vitamins will make you lethargic. Too much putting in your body will make it lethargic. Look at targeted. You get a glucose support that supports your sugar if your sugars come down. We want to support healthy sugar. Common sense is glucose support because we want healthy sugar levels. When you're in menopause, you become insulin resistant, and we all get tummy fat, no matter what you do. So those are important things.
So after
Salicinium.
after the treatment, if you do have side effects, because I do, I have like a nerve. I have a little nerve problem.
In your hands, your
In my
feet.
hands and feet.
Go onto a B complex,
So-
neuropathy. Go into B complex, and then we also want to look at, go into a B complex, was it after treatment? Is there something going on in your spine? We look at your back, we look at, is there something that's peripheral from that? But the neuropathy can come from cancer treatment, and your B complex is very important. As soon as you don't feel that, it means the nerve is dead. As long as you're feeling it, you've still got nerves.
Another question. How after taking chemo and you doesn't really go to sleep right away, what can you take for that?
Okay, so the one thing with hormones is progesterone. Low progesterone levels, you've got onto chemotherapy, low progesterone levels will keep you awake. That's one of them. But we do have a thing called rest, which is a sleep supplement. Rest, we call it restful. It's a sleep supplement. So you want to go on something natural. You can look at melatonin. Melatonin is not bad, but read at the back that it's in natural form, because your body creates its own melatonin. And the problem is when you replace melatonin with a synthetic form of melatonin, your body thinks, oh, okay, I don't need to make it anymore. Then you've got to rely on melatonin. So you can go onto a melatonin, which is natural. And go less is more. I always say go less and then more. I will give, if you got my number and you WhatsApp me, okay, so for 2 weeks you're going to finish it, you just send me a message, or once the retreat is over, you'll be put into a group, a cancer retreat group, we're all in, and then I can send you the links. You can order common sense supplements, are not expensive. I will give you they've given me a rate. You just put the code in. That takes 10% off. Supplements are duty-free on customs. They give us 10% off, which covers your 10% tax at the Bahamas. So we get it at a much lower price than even the Americans get it. and we can order it in. If you're not getting it ordered in and you're struggling, you can let me know, and the clinic can order, and I can always just send it on the boat or whatever to Nassau. You started. You cleaned. You on a year. January you finished all your treatments, and you came in and saw me, and you started on the probiotics, the CoQ10. We started our D3, and you went and saw your cancer doctor. And what did she say?
She told me continue whatever I'm doing. So
You went from this to this.
that,
Like,
that's right.
even the way she looks was like, okay. Big difference. It's just changing because right now, your bellies are hungry for natural. Where a normal person will take some time, your body's like, whoo, whoo, okay, I've missed it. And you just start feeding it, And it's quality of life. It's quality of life. It's not survival, it's quality of life. It's like, hey, I'm feeling really exhausted, what am I going to do? Let's change it, If you're feeling sick, that's the big thing for me on the island, which I'm happy about, is people have flu. Then they're like, I've got flu. I'm like, come, I'll put an IV up. Let's just give you a whole lot of vitamins at once. Let's do things that our body... Chemical medicine is sometimes needed. I'm not saying that it's not. And you speak to your doctor, and you make sure you don't just stop medicine. You just can't do that. But the thing is that it takes over a healing, and your body cannot get in there to fix it. So when you give natural, and when you give the correct natural, it complements your own body in the homeostasis process. And I 100% believe with everything in me, we cannot fix any disease or anything going in our body if our mitochondria is not correct, meaning our cells, our core being cell. That is the only reason not the only, but that is one of the reasons I use methylene blue, because I'll supercharge my mitochondria before I go. So this morning, for example, with me, I've supercharged myself with extra methylene blue because I'm doing a 17-hour flight. I have a problem with blood vessels. I have a problem with clotting. So I have to do that. Then I will do something, extra turmerics and extra stuff to work it on. But I'll supercharge for certain reasons. It doesn't mean I have to stay on the supercharge, but right now my body says this is what you're going to need for the next 2 days, and I'll do it.
What is the ozone or something like that you call ozone?
Gallstone. A gallstone.
Ozone.
Oh, ozone. So ozone is a 3-molecule oxygen. Okay, we produce it using oxygen tanks and a special machine. And what it does is you cannot breathe it. It's a dangerous gas to take directly into your lung. But we use ozone directly into. Ozone is heavier than air, so we can pull ozone in a syringe from the machine, and we can actually inject it directly into your bloodstream, or we can do ozonated glycerin, or we do your blood and we mix it with ozone and we push it through again. But what I do is ozonated auricular. Auricular is I have the ozone like a stethoscope or a headset, and the ozone runs for about 15 minutes through your ears. And obviously, if you've got sinus or anything like that, it's dead and it's gone. And it runs well with the brain, and then it comes through the pulmonary into the body. So ozone is something that kills any virus, any pathogen, any bacteria, anything that shouldn't be there can be. Ozone for diabetic sores, ozone for anything we can use it. These natural, different kind of functional medicines that we use are so open for everything. You can use it for not just cancer, you can use it for a flu. I have 2 patients now in Eleuthera, one in the north and one in the south, with the families had brought their mothers to me with dementia, on the dementia process. And so I've supercharged them with glutathione and coenzyme 10 and methylene blue, and both women have not had a dementia episode again. So they have stopped in their process, and we have them at a place that is good. Because when we cross over that brain barrier and we're able to stop something like that, but it's every person is different. You come to me as a person, individual, and we work out a treatment that works for you. You can't have incredible broken leg and I tell you, well, please go and run and do exercise to get healthy. It's not going to work. You need to do something different. And when we start feeling better, we start looking better. And we start doing things that are better.
Yeah. The acupuncture.
Mm.
You said that's for pain.
I do a lot of bodywork acupuncture, so anything. Acupuncture can be used for anything, but we have two different, we have the traditional Chinese acupuncture, and then we have medical. I do medical MSK acupuncture, which is a musculoskeletal acupuncture. Those musculoskeletal acupunctures still go into the correct peripheral nervous system and meridians, but I would use it specifically. Arthritis of the knee, or before you have to have a knee operation, hip joints, back, spines, necks, anything like that we treat. And we can put some electrical stimulation into it, and with that we do other treatments as well.
Okay, so for you to diagnose me with your products, you will examine me first.
I would love to. I want to sit with you. I'd like to look at your blood. I want to hear what is bothering you, you know, that kind of thing. But you know, you can start. If you want to start with the products, you can. It's supplements, you start. I'm giving you the basics. The basics. If we need to add something for your thyroid, or we need to add something for something different, we would do it. Dr. De Silva has a supplement called Prostate Control that he uses. We use it for prostate, to support prostate. I know that that supplement is going to be changed to a different name. The reason for it is the Prostate Control is also very good for hormones. So he's going to change the prostate name on it, because women are like, I'm not prostate. And so we're going to be calling it something different, because that is something that's an incredible additive. It's got the saw palmetto in it. It's got all the different things, but it's really, really good for our hormones. So it's something that he's now bringing in. When I did a big hormone masterclass with him, and he was like, it has to change, because that's a natural, bringing estrogen, progesterone. It's a natural that we can use. Those that can't take it. So when that comes, it'll have a new name, but you'll have it. But
so now, if I need your service, that means I have to come to you?
no. So everybody in everybody that's here, what we're going to do is that you'll have access to my personal cell, and I'm offering you to send me. You're like, hey, at the cancer retreat, this is what I want to do, and I will ask you for blood work. You will send me blood work within the last 6 months, and I'm going to look at it, and I'm going to say, okay, this is how I suggest you optimize it. If you have any other condition, then we have to see how we're going to work it. We do telemedicine or thing. Dr. Sai, that's going to be here, he can work with me, because him and I are partners. We do everything together. Dr. Sai is in Nassau. He's 1 week Nassau, 1 week Eleuthera, like that, in that kind of thing. But for your health and stuff like that, I just need to see your blood work. Tarpum Bay. Mm. Where are you? In? Okay. So we have lots of patients in Lowerberg, lots of patients Spanish. I have lots that come down. So you just... Ava's sister comes down.
We've been lobbying for our office in North for a day to talk to him. It's so busy in South that she doesn't know. But
yeah, to come up north and stuff.
I go South like once a week, so sometimes
yeah, and I have patients that come weekly from up here. So it's that kind of thing. It's nice to come in.
It's a nice drive.
But I can pick with someone that goes down.
Yeah, we can always. What we do is on Mondays I have my Gregory Town. So I book 3 hours out, and I have different rooms, and then they'll just all drive together, and the guys will come from Gregory Town to me. So it's not something we can't do. We can always do something where we do some consulting and everything like this. I can arrange it with Avis that we just have a spot where we can work. I just have to watch where I practice and what I do where I practice, because the hospital boards is always on my case.
I know. Okay.
Because I am a 2-time survivor. My last was I had met on my brain.
Okay.
And so I was, it was a little tricky for me.
Disappointing,
Yeah.
because you didn't want to have it twice.
No, not only that, I had it on my breast, and then it's like my brain.
So do you see how important preventative medicine is for? Okay, the one thing I can tell you, diabetes is not in your genes. Diabetes is a lifestyle disease. Do you understand what I'm saying? You cannot have type 2 diabetes and say, oh, my mom and my dad and my family, that's why I have it. It's because the lifestyle of what you grew up in and how you did it, That's what affects it. Also, diabetes takes 15 to 30 years. So as a child, whatever you were fed is going to come back in this sense now. Our food has chemicals in. We have all that. Unfortunately, we're so close to America, we get all then, I'll say, there's shit. Sorry. We have it. We have a problem with the farmers here. The local farmers, not all of them. What do they do to save their crops? They fertilize. Who's using well water here? And then you've got someone fertilizing over there and you're drinking the well water. It's little things. Sun lotion. Sun lotion. We have a different sun lotion. Sun lotion. Don't use sun lotion.
Right.
Other thing I'm going to end off with today is,
If you can't use suntan lotion, what do you use? What should you use?
your body's okay. Your body's actually okay.
I've been using.
Your body's not going to, nothing's going to happen. Your body, you're going to get cancer when you put chemicals on and then go and stand in the sun. Your body gets used to it. Your body is something that's naturally, that can get used to it. You can cover it up. If you need a sun lotion and it's something, you've got a very sensitive skin, we can ask Avis. We have, Dr. De Silva actually has a sun lotion. We have a sun cream that is made with non-nano, and it's all plant-based and everything like this, which is great. And it doesn't go all chalky and stuff, so it's really nice. But I've even stopped using it. That's why we're vitamin D. We live on an island, we cover ourselves up, and we never get into the sun.
Right.
Okay. When I was talking about the acupuncture and it grounds you, where the thing is where we're taking positive and negative energy in the body that's running through. The other thing that grounds you is grounding. Grounding is not a Zen thing. Grounding is actually scientifically proven to help. And the best place to do it is ocean, where the water breaks and the soil is wet. Not in the water, where the soil is wet, that's the best. Feet off, negative ions will leave through your feet, positive ions from the ground will come up, and then obviously the water. I have patients that can't walk, and they get the family to bring buckets of the ocean here and just put their feet in it. Because we do not have ships and stuff in a lot of our places here. We don't have all that. There's so much minerals that can go into your body.
How about when you do toxins, you do it in the green grass and in the sun?
Yeah, you can. Oh, when you want to do grounding.
Yes.
Anything natural is fine. Obviously, not if you've just fertilized.
No.
In the Bahamas, be careful of fire ants. But you can stand on anything that's natural. Soil is always great. So even if it's just gone like that, but it's anywhere that's natural, is to walk barefoot.
That's what I do sometime in the afternoon.
It's very good.
In the morning, I would just go to the back of the yard in the green grass and just,
Perfect.
yeah.
Because remember, what happens with a supercharged electrical storm or a lightning bolt? It finds ground to ground it. Got to pull that back in. Grounding is very, very important, not only for your body and what it does, but also emotionally. Ladies, emotional stuff, I believe that the physical and the mental are one of the same. If mental's not doing well, physical won't do well. If physical's not doing well, emotional won't do well. Yes.
Yeah, I was just wanting to mention about grounding. Not everybody can get by the beach, but we tell them go outside, hug a tree.
Hug a tree, yeah. Touch a tree as long as you're grounding and you're touching. If you can't get to a beach, get someone to bring you some sand and just put a little bit of the ocean's water on. Just stand on something.
Take your shoe off.
Yeah, shoes off. Shoes off. But grounding is a really, really good thing. I wish I was spending this entire weekend. I literally was booked for this weekend, but unfortunately my son has to go in for surgery and he's in South Africa. So I had to change my flight a week. I was only supposed to leave after, which I was gonna be here and make you guys swim in the ocean with me every day. But I'm glad that I came. You guys are blessed. There's so much. I am available anytime. Doesn't matter. We're all in the same place. We can speak on the phone. If you get something, hey, a doctor's told me this or someone told me this, ask me. I'm a coach. I'm going to say to you, no, go find out. I'm going to teach you how to be your own health's advocate. That's my job. And I'm going to call a spade a spade.
Yes.
Okay. Just going back onto supplements, important. Your vitamin D, your probiotics, and your omega-3s are really great. Vitamin C is a cancer killer. Vitamin C, your body can't absorb iron without vitamin C. Your body cannot produce calcium. Calcium cannot move into the right parts of the body without D3. D3 can't be in the body without K2. K2 also helps a little bit of thinning of the blood. Magnesium cannot absorb without calcium. Magnesium and D3 are not just vitamins or supplements. They are called essential, meaning without D3 and magnesium, we should die. There's a difference between something, an omega-3, and there's a difference between an essential. Essential means your body can't function. Bring your magnesium, go to magnesium and your coenzyme in, your heart health starts working, you might not need your blood pressure medicines. If you want statins, call me.
How about the chlorophyll?
Chlorophyll's fine. I can't comment on it in the sense of who's making it, where's it getting produced, where you're getting it from, in that kind of sense. It's not about, same as CMOS. CMOS is great, but who's picking it, how they're processing it, where they're doing it, that is the main thing. All these like incredible bush medicines and stuff, it's not about the medicine itself, it's about how is it processed. Also, the other thing is that be careful with bush medicine. You can't just take bush medicine. It's like me putting all the medicine here and say, oh, just take something until you feel better. You've got to understand what contradicts what and where in bush medicine. I love my bush medicine every single week from Gregory Town. They bring me 2 bottles and I drink it every week. And I always got beets. Always, because I know. Or, but you've got to be very careful what you take. I had a patient that came in, he's like, oh, bush medicine. And he came in, I'm like, wow, what did you smell? Something's wrong. And he was on so much bush medicine that it was like, he was sick.
Yes.
You can't just take anything like that.
For now, the only bush medicine I take is soursop.
Perfect. Soursop's great. Papaya, great.
Yeah, that's the only
Yeah,
one I take.
but you always just want to, there's lots that you can take. Bush medicine you can always speak to Avis about. And what you can mix and stuff like that. That's really good.
Yeah, she was one of my mentors when I first started out, because I read it all.
Yeah.
And I always would talk it all,
Yeah.
Because I didn't know what it was.
No, you don't. And there's so much information in there. There's so much information. What I would like you to do is take the information and question it. It's the information. If there's a side effect to it, are you willing for the side effect or you're not? That's how you got to do it. When you're on chemotherapy, that's needed to kill your cancer. It kills everything else as well. So therefore, right now, you've got to fix all that. Okay, I have to go. I thought I could drive fast, but these potholes, they're terrible. And I took 2 hours to get here because I thought, imagine I phone Avis and say, Avis, I got a flat.
No.
Like, no, I can't.
Thank
Okay.
you so much.
It's such a pleasure.